the video. Hello, Cam followers. It's very good to see you. I have my lovely friend Evie. We're still at work, so we're all kind of in our skanky vet clothes. And we've got the lovely Caroline Clark joining us tonight to talk about pain and its association with behaviour. I'm going to let Evie introduce herself, then Caroline introduce herself, and then we will crack on.
So I am Evie. I am one of Hannah's nurses in Cornwall, working alongside her to create pain clinics, and trying to make it more recognised. And
sorry, that's me. I'm doing this. Apologise. That's me.
So yeah, that's me. I've also seen you all on Facebook Live before.
Yes. Now, Caroline, tell us about yourself.
Hello, thanks for having me. I'm Caroline Clark. I'm a registered clinical animal behaviourist, but my background's veterinary nursing. I qualified way back in 1989, so a long time ago, and been involved. Old woman. I've been involved in veterinary nursing on and off ever since. I went to teacher training, did some teaching, but ultimately came back to veterinary nursing. And throughout that time, I had a real interest in behaviour, as a lot of nurses do, and went to Southampton and did a postgraduate diploma in companion animal behaviour counselling, and studied under some of the fantastic people there, Sarah Heath, Anne McBride. So I was really very lucky. And then in 2006, started to run private clinics freelance, but always maintaining a foothold with the veterinary practice, doing clinics in veterinary practice, clinical coaching. So I really rooted in that veterinary nursing world, as well as the clinical animal behaviour stuff. So yes, that's me.
Which this is really exciting, because it's good to be chatting with people that see the different areas that this multidisciplinary team that we keep talking about works in, and the positives, the negatives, the obstacles. So the fact that you have a foot in a in-house presence, an outhouse presence, a teaching and coaching presence is going to make this really quite topical. Because we do have challenges in practice. I think a lot of people find they meet them, communication, belief systems, training, qualifications can collide. But we'll come back to that in a bit. So you've already decided how we're going to lead. Start it off.
So this evening we just put together an agenda for you guys. And we've got some very exciting things to talk about. As Caroline's just told us about the qualifications she has and things like that, I think it would be a good point to start with how to find a behaviourist that has a good qualification, and that also will work alongside the veterinary team. I think people get quite bombarded. If you type dog behaviourist into Google, thousands and thousands of people come up, but whether they have a proper qualification is a different thing. So what would you recommend to people that are looking for a behaviourist, Caroline?
Well, you're right. It's not a regulated profession. It's not a regulated title. So you do have to be a bit careful. It's always good. I mean, there are quite a few different routes into behaviour counselling, and so there's quite a lot of different qualifications. But what I would recommend that people always do is look to see if that behaviourist is accredited and belongs to an accredited body. So we've got the Association of Pet Behaviour Counsellors, we've got the FAB Clinicians, which is the Fellowship of Animal Behaviour Clinicians, we've got the Animal Behaviour and Training Council, and these are all recognised bodies that will only allow you to be a member if you've got relevant qualifications and you've undergone really rigorous sort of background checks, and also that you fulfill the qualifications that are necessary. So it's really important to do that. I think having the theoretical experience as well as the practical experience is really important too. So yeah, it's looking for those key things really, and just kind of going with your gut feeling too. Sometimes when people are using fairly punitive and corrective sort of talking about trainers now, training methods, always question that, but do look, certainly from a behaviour point of view, always look for those, that the members of those regulated bodies.
Yeah, definitely. And I think if anybody is having any struggles, because it's confusing.
It really is, yeah.
I just find it's loads of acronyms and I'm like, oh my God. And if you're trying to know the physio world and musculoskeletal practitioner, and you've got the behaviour and you've got the dog trainer, the acronym crazy.
Yes.
So
yes.
What I would suggest is always have a chat with your vet practice. They tend to have relationships that can start your journey.
Yeah.
Perfect. All right, so let's crack on with the topic because it's so trending at the moment. It's so exciting. So just because I want to do a little tangent, when CAM started, 2016, it was still quite focused on a physical presentation of pain. And that's where we were at as a veterinary profession, signs of lameness, signs of musculoskeletal discomfort. But even just in this last 8 years, we're seeing a huge surge to behaviour. So it's an exciting time and it's a very, very topical area. So
it really is, yeah.
Start us off.
Well, often I think sometimes it's the behaviour that manifests before any of the physical signs of pain, and that is one of the really important reasons that it's a good idea to get a behaviourist with that kind of knowledge, because if you have the blinkers on and you're looking just purely at the behaviour, you might miss those elements of pain. And there's so many. I know you've talked to some fantastic guests and I've kind of followed them as well, and talking about some of these obviously musculoskeletal degenerative joint problems, which is kind of what we're talking about mainly tonight, but other things, other medical conditions, gut problems, skin problems, these also feature highly. And so it's really important that as a behaviourist and as an owner, that you're not just sort of swept along with the behaviour and you think the dog's being naughty or whatever. It very, very often, and Danny Mills at Lincoln sort of estimated, a low estimate, it was going to be about a third of cases that had the behaviour cases have got some relationship with pain, and that's a conservative estimate, and that was done looking at sort of retrospective cases. So that's high, and that's a sort of a low estimate. He's sort of saying, and him and his colleagues are saying it could be as high as 80%.
Yeah.
So it's
let's spend a little bit of time there, because tell me if I'm wrong. I can remember them saying that the people out of the survey, the clinicians that had higher percentages, they did a lot more first opinion work, where the lower percentages, the 27 to 40%, were in a referral setting. So these owners had maybe seen a frontline behaviourist, and then they'd gone referred to people higher up the chain.
Yes.
So in many ways, a lot of who we appeal to and talk to across the globe are going to be first opinion consults first.
Yeah.
And that percentage of caseload being associated with pain is at the higher end, up to 80%, was some people quoting.
And it can take quite a long time to actually find pain, and I often talk about this, and it's definitely not a criticism on vets. I've worked with vets for many years. I have the utmost respect for them, but they can miss pain, and often doing it, this well, that when you're carrying out an examination, the dog is rigid, it's standing there, it's I'm not going to show any pain, because that would show weakness in an animal, so they try and sort of kind of mask it. They're so tense that you're not going to get a pain response, and sometimes an abnormality a dog can learn to live with it, and can learn to sort of kind of mask that as well. It becomes their norm. So that's the other beauty, I think, about a behaviour consultation. You've got time to actually spend. I'll sometimes go on a test walk with somebody. You don't pick those things up a 10-minute consult when they're walking through the door, and they've got a lot of them are scrabbling on the floor, and then they're on the table, and you just don't get to see them moving as normally as perhaps I might, or another behaviourist, when you're spending, a minimum of an hour and a half that's a minimum for me for my consults. So and you know, if during lockdown, even seeing videos and watching videos, you know, you're picking things up, even just slight sort of, and I like videos. I always ask people to send me videos to analyse as well, because you can slow it down, you can have a look at it, you can sort of keep playing it over. So yeah, you know, just because you can't actually see something in a consultation, in a veterinary examination, doesn't mean to say that there isn't something going on. And sometimes it can take, I'm not too frightened to refer back again. I think because of my veterinary background, I find that easier, and I find that conversation with a vet easier, and they'll converse with me. But some of my colleagues that perhaps haven't got that veterinary background find that there can be some resistance there, where they're saying, well, actually, I think there is something, you know, I'm going to refer it back. But then the vet, you know, maybe says, well, I've already examined it and I've x-rayed it. Even an x-rays, you know, doesn't always pick up things. So yeah, it can be difficult for a behaviourist to do that. I've been quite lucky, I suppose, because of my background. But yeah, there is that, having that conversation.
Very difficult, and I think everybody involved finds it difficult. You know, the owner maybe doesn't know who to turn to. You know, I listen to the behaviourist outside of the vet process. They listen to the vet. There's a potential for a lack of trust in both parties. You've got the vet who's going, well, am I missing something? You know, what am I doing? And, you know, I don't want to put them on medication in case they had a reaction to the medication. And the owner's coming to me going, I think it might be painful. I don't know. I'm just listening to her. And then if that owner came back going, well, she said it was pain.
I know.
I don't think it's pain. And now my dog's got diarrhea and it cost me 40 quid. You know, so the vet's going, really tricky. So we've got to learn how to work together, and I think it's the $1 million question. You know, I get approached a lot with how can we make the flow better? How can we help behaviourists speak to vets, vets to behaviourists, owners to sit in the middle of the two? It's on its way.
Yeah, I think it is. I think it's kind of, I mean, I remember when I first nursing a long time ago, we've come such a long way. You know, we've got more paraprofessionals and working in this sort of multimodal way. That did not happen when I was first nursing. I mean, I'm going back quite a long time. It didn't happen. So I've seen massive leaps, but obviously we still got, you know, we've still make things even better. But yeah, we have come a long way, but still some way to go.
There's still stuff to be done. So I think rather than focusing on an area that we know is a problem, we know we've got to work out how to do pain trials. We've got to work out how we can communicate very different languages. Veterinary language with behaviour language is very different, and both can be intimidating to each party.
Yeah.
But for now, it's on the mend, and stick with it, guys. Do not be downhearted. Whoever is listening, if you're a behaviourist, don't be downhearted. Vet, don't be frustrated. And owner, don't give up. So let's now kind of really tantalise people with the associations that you've seen, and kind of bring some real life to us.
Okay, I mean, there's been a lot of cases where, you know, the sort of first manifestation often is fear and anxiety. There's this real relationship with that emotion. Dogs in pain are sort of more defensive. They're much more reactive. And the other thing that I've found, you know, reactivity is one of these kind of common things that behaviourists see. A dog that might be overreactive when seeing another dog or a stranger, and we'll sort of think about all the variables. I always say about behaviour is like an onion. It's got lots of different layers, and the longer it goes on, you get more layers, and sometimes you've just got to kind of take the layers off. But when we're talking about pain, you know, you've got a dog that is potentially feeling fear and anxiety for whatever reason, maybe lack of socialization and a negative association with another dog, but then they're lunging towards that other dog, and ow, that hurts. They've got going on at the same time. They might have sort of cruciate problems, hip problems, elbow problems. The dog's on the end of a lead collar, pulling to get to the other, you know, the object of the fear. And so you've got that pain that's creating a more negative association with something that they've already got a negative association with. So that could be, sometimes it's a primary problem, sometimes it's a secondary problem, sometimes it's all kind of part of that onion where you've got all these layers and this sort of vicious downward cycle. But if you don't address the pain, you're never really gonna get to the bottom of what the problem is. And that's what fundamentally behaviourists need to do, is to find out what's motivating this dog's behaviour. Now, sometimes because of the onion and the different layers, it might be pain that's the primary, but then you've got all these other layers that you've got to kind of make. That's why I love it, because it's a bit like a jigsaw puzzle, I think, in all the pieces.
But I think it's also quite frustrating as well, because like we can all get the direct association, as you say. If you're in pain, and your mood is different, your tolerance, your ability to cope with changing situations is different. And you can get that direct association. But going back to Daniel Mill's paper, there were other categories of association. And it might have been that a dog was improving on a behavioural modification plan, but didn't quite get as good as they wanted it to get. And they're like, well, why haven't you completely improved your behaviour? Or it could have been as soon as the behavioural modification plan started to take a more conservative, we've done all the work and now we're going into a management plan, then it would recrudesce. But why? So, as you say, onion, I'd call it smashed onion. Like onion. And there's no layers, isn't it?
They're all stuck together. Getting them apart.
It's hard work. I think
it really is. I mean,
just remind people though why getting to the source is problem. From my perspective, it's a welfare concern. Any kind of unmanaged pain is a welfare issue. It goes against my oath as a vet. But now take that out of the picture. Why not dealing with the primary source? Is that going to be a problem?
It's going to be a problem because kind of looking at the onion analogy, you're going to get different the longer it goes on, you've got habit forming. So that's a massive thing with behaviour. If an animal behaves in a particular way, if we behave in a particular way long enough, then it becomes part of an automatic response. So that it becomes a default behaviour. Obviously, the pain is going to cause those negative associations, possibly new negative associations. So and it just kind of snowballs, really. So you've got to get to the bottom of it. And often it is part of this multimodal thing, because it's pain management, it's managing the behaviour as well as treating the behaviour. And sometimes, there are things that you need to initially manage. You can't just suddenly, it's not a quick fix in most cases. So also you've got to be supportive with the client, give support over a long period of time, because it's not a quick fix. And it's, there's been studies that have shown that having a dog with difficult, problematic behaviours is quite draining on the owner and causes them to be fearful and anxious. And of course, very recently from Belfast University, there's been some further studies on top of what we already know, that a dog can detect your stress on our breath, in our sweat. So then they go, hang on a minute, there really is something to be worried about, because they're frightened as well. So it's just this whole, it's never that straightforward. And that's something that I remember when I first started out behaviour counselling, a few years ago now. You would be, the owner would tell you what was wrong, and you got a little bit blinkered. It's experience, like all of us. I say to clients, I wasn't born with all this knowledge. It's what I've learned, but it's also through those years of experience to say, hang on a minute. It's not just that. Let's just kind of look at the bigger picture here and take off the blinkers and look at what's happening. And as soon as you tell an owner, you get that sense of relief that they just understand education is so important. It's like, I understand now what's going on. And that really gets, they're on your side, because you have got to work, owners have got to comply with this plan that you make, that you design. It's got to be a two-way thing as well. There's no point in giving somebody a plan. Follow it.
I think bouncing back to the vet aspect of it as well, is that you've said that if a behaviour, the driver, the motivation of that behaviour isn't best managed, it can snowball. And that rings in my head very true with my dog having a noise phobia. It started off with just bottles clashing, and then it grew to car doors slamming, and then it grew to, and you were like, I actually can't go out now. You know, really did snowball. But also the disease causing the pain can snowball. And anybody that watches CAM on a regular basis knows that we're not dealing with arthritis of the knee that's going to stay the same forever. It's going to potentially progress. And it's going to remodel your nervous system. It's going to remodel your physical self. So actually addressing the motivating factor is beneficial for behaviour, but it's also protecting the body from further disease progression and all the comorbidities that come with it. So I just wanted to deal with that, because I do every now and then meet an owner that will go, oh, well, can we just not fix the behaviour? You're like, no, no, can't, you know, let's just leave that stone in your shoe for the rest of your life, shall we? If that's okay with you, and you're like, no, it's okay. It's okay. So, yeah, it can be quite laborious. And now thinking about trying to find pain that isn't obvious is hard work.
That is.
And it can be costly.
Hard work for the vet, and frustrating for the owner, and kind of difficult for the behaviourist, particularly if you think, actually, I think there is something going on, but the vet doesn't think there's something going on. The owner's sort of saying the vet doesn't think there's anything going on, and then it's very difficult, because you know you don't want to. I'm not a vet, you know, and I'm not a vet. I never professed to be a vet, but sometimes there's just this feeling that there is something going on. It really doesn't.
How do you do that? Because like I found that with my rehab stuff, my questioning is getting longer and longer, and the questionnaires are getting more and more extensive. And I can remember seeing a behaviourist pre-consult questionnaire, and I was like, good God.
The will to live before you fill it in.
It's quite intimidating. And I think for owners that their dogs basically started to show maybe dog to dog like a reactivity, and they're thinking they've watched a few programs on the BBC and it's all fine, that's all you need to do. They come to see you,
Teleland,
a tome of questions before they even get to meet you, and they're like, hey, I didn't sign up for this. Is that something that you experience as well?
I think, I mean, and I've seen, you know, and I, again, talking about experience, you know, when I first started out, I've slimmed them down a lot, and I've slimmed down my reports a lot, because, you know, you want to kind of give people as much information as possible, but at the end of the day, they just want to know what the problem is and how they can fix it. They don't necessarily, and sometimes I'll tell people, you know, what kind of report would you like? It's kind of the package that I do. And I explain to people, you know, some people do want to know everything there is, but not everybody does. And I'll sort of kind of give an overview to the vet and to the owner, and then depending on what they've asked for, give a more detailed report if they want it. But I've definitely slimmed that down, and I work with a lot of new sort of mentor behaviourists, and they'll often, it's the biggest question, it takes me ages to do the report, and I'll say slim it down a little bit, because it's better for the owner. And you know, if they want something a bit more detailed, give them links to things to read themselves if they want a little bit more information. But yeah, the questionnaires, you could sometimes think, God, you know, lose the will to live before I've even got to the behaviourist. And I think it can put some people off. The thing is, there are certain things that are so important that owners maybe don't think is important. For example, what do you feed your dog? You know, I will often say, does your dog have problems with diarrhea? Have they got gut issues? Because there's a lot of dogs with gut issues that can be the driving force. We'll often ask to look at the medical records if the vets will share them with us, pick things up there even, you know. So it's all part of this jigsaw puzzle. But you're right, it can put people off, and you've got to be very careful that you don't overload.
The gut thing, I don't, because me and Evie talk about everything. I must admit, the other day you came around for dinner and I suddenly felt really unwell, didn't I? And I had to go and lay down. And it was a gut feeling. It was that hollow, sickening, slightly crampy, and no one would have seen anything wrong with me. I actually said to her, I've got to go and lay down now.
Yeah, it's not nice.
And just imagine, that is, they're mammals like us.
Yeah.
As you say, the things that you can't see, it caused a profound behaviour change in me.
Yeah.
I was nice about it, but I could have easily gone, I'm just
yeah.
But, I think we forget how many sensations we feel, feeling
I get
out of breath.
gastritis, and it's horrible. And one of the things with gastritis for me, I feel hungry. It's that groping pain, and it feels a bit like hunger. And what I used to do was think, I need to just eat to feel better. But then, of course, that made me feel worse. And so a dog that's eating, what's their appetite like? Oh, they're eating ravenously. Okay. It's just all these little things that sort of kind of go into my little brain, and I just make these little notes. It kind of doesn't seem much to the owner, but it can.
Yeah.
There can be something, and then when the jigsaw puzzle, you get this next bit of information. He licks a lot. It's always licking, and again, that can be a sign of gut problem. So then, before you know it, you sort of start to see something else emerge that the owner was absolutely not aware of at all, and probably the vet wasn't, because the owner hasn't thought it was anything necessary to talk to the vet about.
I don't know, but there's so many things that we communicate that we feel that no one would know. I'm sure that my dog had a migraine. Okay, this is totally crazy, but Holly, at one point, she became photophobic. She was getting really quite stressed and panting, and when I took her outside, she threw up, and that's kind of quite a classic migraine type behaviour. But is that in the literature? No. Is there anything to say that? So headaches, pounding, feeling
horrible,
all these sort of things are going to change behaviour. Okay, I keep standing on your toes, but
gritting her teeth.
We've been working together since 8:30, and it's like, what we do need to do is give people like tantalizing stories that give hope and excitement, because if I was listening to myself now, not knowing our world, I'd be feeling quite defeated. And this is scary, and I don't know if I've got the resilience, the finances, the time. I've got a lot going on in my life. Let's do a couple of cases. Talk to us about a couple of cases. Let's start with something simple, something that you were, oh my God, that went so well. I couldn't even blink enough. Wanted that to go better than that did.
Yeah, they're always nice. They're always nice. Yeah. I remember quite vividly a resource guarding dog. That's what the owner said. This dog's resource guarding. Whenever we go near him and he's got something, he's having a go at us. Was with my husband. So they didn't think that it was, when I initially sort of kind of thought about pain and asked about pain, no signs of pain that they could note. They sort of said, well, it can't be that because it's worse with my husband. But then again, part of the questioning is, how do you respond when he does it? And the husband was a little bit more punitive about the way he dealt with it than the lady owner. So obviously, this dog potentially was not wanting anybody to come near. I mean, when you're not feeling well, you don't want to be bothered. But if you're in pain and somebody's coming towards you, you've got that defensive sort of kind of behaviour. But for all the world, it looked like resource guarding. But when we went for a test walk and just watched this dog moving around, and even when we went to the sort of kind of back end, he just sort of kind of looked round, get off, didn't snap or anything. This was when he didn't have a resource. This was just generally sort of kind of meeting him and finding out a little bit more about the behaviour. There's definitely not keen on you touching around his back end. And this was a young dog. Fortunately, it was a practice that I know well. Asked them to go back and just check him out. And when they examined him, and there was no outward sign that the owners could see, and to be honest with you, I couldn't see any lameness other than this sort of kind of being a bit defensive when we went around the back end. He got really bad knees, cruciate problems. And so once the pain management went to see a physiotherapist, spoke to the husband about kind of how we deal with resource guarding, because there potentially some resource guarding going on as well. And we sort of kind of that multimodal thing that you're talking about, never did it again. Never did it again. I mean, they don't always go quite so well as that, but you know.
No, they are quite cool. Like, can I tell you about Hamish, who we saw today?
Okay. Yeah.
So Hamish is a Westie. He's 10, 11 years old. He's old boy. He's old boy. Terrible reputation. Very bad reputation. He's permanently livid. And the lovely owner, she was just kind of like, well, he's getting old and he's getting cranky. And when we actually persuaded her to let us sedate him and have a good look over him, absolutely horrendous elbows. They don't even move. Knees, awful. Lower back, super sore. But also, when you actually looked at the base of his feet, because his digits had collapsed over time with tendinopathies, the skin between his pads was obviously touching the ground instead of being raised on the digits and hidden between the pads. It was all ulcerated.
Oh, bless him.
And it was all hidden by fur. So we had a great day because we had kid and we were giving him lovely drugs like Comfortan and ketamine and everything. So he was like, "Wow, look at this!" And we got him into a management plan. And he came back today. Yes, he's still cranky, but oh my God, his ears stayed forward the whole time. They didn't go back once. He didn't tell me off at all. He allowed his owner to pick him up and we had a good look over. And that was not possible a couple of months ago. No. So yeah, we're never going to get him back to a prize beast, and we're always going to have to be a bit careful of our handling. And you know, I'd hate to say it, I'm never going to get fully on top of his pain. Yeah. But he's gone from having quite a low quality of life and being
good quality
to a good quality. He's not being segregated as the grumpy one. Yeah. And he's not being left in another room when guests come because he's unpredictable. He's now integrated back into his social group, and it's just
and it is that sort of human sort of animal bond, isn't it, that can be that, as a behaviourist, you see that can be really, and you'll see that as a vet, it can be really badly affected. It can affect that relationship, and to sort of kind of tell an owner why a dog might be behaving in a certain way, they almost, you know, you can see them straight away having compassion and saying, "Oh, I wish I'd have known. Oh, I'm really sorry." And you can kind of think, "Oh, you're mending that sort of broken relationship." So it is really rewarding when you're involved with something like that.
I had one owner like that when I was working in Brighton, and her dog had been called Mr. Grumpy for at least 6-7 years. Turned out it had intervertebral disc disease. And once they actually identified it and operated it, he went back to being the most sweetest, lovely dog. So you do have some real positive turnarounds that are pretty solid. They maintain themselves quite nicely. But now let's be realistic. We also have cases where you are managing the pain to the best of your ability. You are managing the behaviour to the best of your ability, but it's still a difficult relationship. Have you got a case like that?
Yeah, I mean, quite a few like that. And I often will say that I sometimes think one of the things on my questionnaire right at the bottom is, what do you want from the behaviour consultation? What are your what are they expecting? And because I think that's really, really important when you start out with a client, is to give them realistic expectations. And there are some, as you'll know, with some of the medical things, you know, you might never cure that pain. You might never, ever get on top of that pain 100%. But if you can get on top of it to a point where that dog's quality of life is better. And I will sometimes say that with some owners, you know, depending on the behaviour, of course. But, you know, if you've got a dog that has got real deep rooted fear and anxiety issues, because the mother was anxious, because they've had some negative associations as a youngster, because they've possibly got pain, and that's created more negative associations. You're never necessarily going to make that dog love every other dog that they come across, but you can give them coping strategies, you can give them sensible management strategies. You can explain what's going on so that people kind of understand that and say, well, okay, I know he's not going to ever like these other dogs, but I know what it is I need to do to give him some distance, give him some space, even giving them some sound advice about restraining aids, collars and leads when you've got a dog lunging up. I'll often talk about well-balanced harnesses and how that can make a big difference to link leads, so that the dog's not bouncing up and causing that compression on those joints. So sometimes it's management, but I always say it's quite a common saying of mine is management actually is treatment a lot of the time. And if you're dealing with stopping those habits as well, and you're rewarding alternative, much more appropriate behaviours, then they become the norm. So people say, well, it's management, but things have really improved, or he has. So management definitely is treatment for me too. But it is important that people understand what we can achieve. But once people know what it is that they should do as well, they've got a plan, they feel better already. I know what it is I need to do. So when they're trying this and then they're trying that, and then, oh God, what do I do? It's just a downward spiral.
Yeah. So give people a bit of a time scale. I know this sounds awful, but I feel that one of CAM's roles is trying to bridge the gap between clients and dog owners and their professionals, be them a behaviourist, be them a vet, be them a vet nurse, be them a rehab therapist. We try and get people equipped emotionally and cognitively ready for their next part of their journey. So dealing with people's expectations is a really important part of that, because most complaints I found in the vet industry is about not managing expectations, not managing someone's bill expectation, recovery rate expectation, diagnostic test expectation. So let's play some expectations here. If you had a dog, let's use German Shepherd, 7 years old, it's been a problem now for about 3-4 years. It's actually been rehomed because of it. It's in a new loving household, and they've got a dog that is really, really averse to any other dogs in the surrounding area. As soon as they see them, absolutely hyper alert. It turns out the dog's got lumbosacral disease, bilateral hip dysplasia that's got OA now. So he's got a significant amount of pain. And you pulled all this together, and the lovely owners have gone, we'll do anything. So it's had diagnostics, it's on a new pain management plan. How long? They want to walk their dog. Yeah. And they want it to just be pleasant for all people involved. They're happy to walk in parks where they don't interact with other dog owners, but they don't want to have that reactivity as soon as he sees a dog 30 meters away. I know it sounds daft, but let's just play with people's expectations.
Yeah. I usually stage a plan. So I'll say, right, we're going to do this in stages, so that stage 1 might be something as simple as, right, we might need to give a dog some time to decompress, just relax down, give you time to practice some of these different training with some of these different training aids. I'm going to talk to you about the harness, for example. I might say, if possible, take him somewhere quiet. I call them ugly walks. Ugly walks are those, and actually this was a phrase that one of my students gave me, and I think it's a really good way to describe them. And it's taking a dog to places where owners tend to think that they need to take the dog to places where there's woods and there's things, but actually if you go on a sort of a shopping centre after everything's closed, there's still some great smells around. There's still things to see, but there isn't a load of folk there. Everybody wants to take their animals to where there's woods and things like that. Now, the thing is, I will often say to people, this isn't forever, but this is just in this initial stage when we're getting your dog used to listening to you. There's not as many distractions out there. There's some great smells. He's still being stimulated. You can still take him out. It doesn't cost you anything. There's some great dog playing fields that you can hire, but there's a cost there. So, if at the moment our budgets are kind of tight, you can go when it's quiet after closing time, take your dog for a walk, but not feel under pressure that you're going to meet Uncle Tom Cobley and all. So it's kind of giving people these little bite-sized things to do, encouraging them to use more enrichment. I know Amber Batson was talking about this, some of the exercises you can do. Getting them engaged with the nose. Dogs love to sniff. It's kind of this amazing sense that is so, we don't use it enough, we don't allow them to use it enough. So giving them things in the garden, setting up things for them to sniff in the garden, and opening up that sort of idea of what actually is enriching for a dog without our concept of what's enriching. And then the dog decompresses. The owner begins to see an improvement straight away because the dog's mood has improved, because he's not angry every minute of the day or 3 times a day when he's taken out for a walk. The threshold is just high all the time. They're always ready to react. Whereas, if he's relaxed and we can do these things, straight away the owner sees an improvement. The dog's less reactive because they're not, kind of reaching or above threshold all the time. So it's staging it and giving owners these sort of things that they can see an improvement fairly quickly before the next stage and the next stage. And I think it's making sure that owners understand what you can achieve and seeing these positives along the way that keeps them going.
Yeah, definitely. I think I've found with the rehab, because there's a lot of similarities, is as long as these stages are incorporated into lifestyle and they are actually doable and pleasurable.
Yes.
Some of these like rehab plans we create, people just keep going for the rest of their lives because I quite like doing it.
Yeah, it's fun. Yeah, it can be fun, and you can have, like I say, it's building that bond. Often some little training things that I'll give people to do, sort of touch your hand, let's try a little bit of touch, and the dog's touching and the owner's going, oh wow, isn't he clever? And it's already, I know when I do these things with my dog, I think, oh, she's so clever. I just love her so much because she's engaging with me, and it's beginning to improve at what the relationship that's been kind of damaged a little bit because of the behaviour. So it's lovely when you see that, and then they're sending me videos of what the dog's doing, and it's nice.
I think another thing to manage people's expectations is something I was talking to Amber about before we went live yesterday, is many of her clients are actually clients for life. And if she's been working with a case and it's been a project for 6-12 months and they finally got into a relationship that is now livable, dog is content, has its boundaries, that's what I'm happy to go as far, and the owners know where the boundaries are and they have that symbiotic happiness, and there may be blips, but Amber finds that the owners are often still in contact for a long time after they've hit that happy baseline. Do you find the same?
That's probably, I'm talking to colleagues, you do get that, and it's lovely, and people will often check in and tell you to send photos, but there's quite a lot of people that don't, and you'll get in touch and say, how's it going? You don't hear anything. How's it? And after a while, there is only a certain point where you can keep doing that. And then you're left wondering, I wonder what happened with that one. And then somebody will say, oh, I saw so-and-so. Oh, the dog's doing brilliantly. Particularly sort of, maybe I'll see or speak to a veterinary nurse that it was a client. Oh, they're absolutely. And you think, why didn't they tell me? So sometimes they do go. And I think you either don't hear from, most of the time you don't hear from them because things have gone well, and that can be a bit frustrating for us because we always like to know what's gone on.
Yeah.
So yes, you do get a proportion of people who will keep in touch, but you do get quite a big proportion of people who you don't hear from, and you sort of kind of like wondering, how's that gone? So that can be upsetting, really, frustrating but quite upsetting.
Yeah. So again, just doing expectations before we move on to Bonfire Night, which is looming.
Yeah.
And I'll let Evie do some talking. Expectations again. So how many times would you envisage you might see someone? I know that's $1 million question. It'd be like someone saying to me, my dog's just had cruciate surgery. How many times are you going to see him for a rehab plan? Well, it depends on the dog. I can't promise that, but I'd like to work in the realms of 3 to 4 months. And I'll probably see you on twice a month when we're at a good stage, but initially it'll be weekly. Do you have anything that you could plant in people's expectations plan?
Well, I work a lot with trainers as well, so I have associate trainers, so I might kind of see that client 2-3 times, maybe a follow-up afterwards with Zoom, but the trainer works with me, so I'll say, right, and because I work throughout Yorkshire, which is a big county, so I might see that client a couple of times, but I'll then put them in touch with the trainer, and that's really important because sometimes a behaviourist might see the client a couple of times, but I think it's great part of this multimodal thing, I suppose, within our sort of profession as well, giving them a trainer that's local that they then can buddy with, or that trainer can work with a plan that you've designed. And often I'll say to the trainer, look, I have complete faith in you. If you think there's something else that might work really well with this dog, great, go for it. You've got to have trust in who you're working with. And so there's often, although that I might not see them for that regular training, I've got somebody in place who is seeing them for that regular training, and then we're liaising. So depending on how confident the owner feels about implementing some of the training themselves. I often find I'll always advise clients to use a trainer as well alongside the plan. And it's a good idea to use a trainer that the behaviourist recommends, because then you're all singing from the same hymn sheet. I mean, some behaviour problems, you're a year on and things are improving, but they're not, that you've got further to go. Sometimes it can be 3 months and people say, well, this is enough for me. I know what it is now that I need to do, and it's great. Thank you very much. And I know, it's not 100% there, but I know what it is I need to do. So it really depends on the owner's confidence, depends on the case. And to a certain degree, it depends on whether the owner wants to actually carry on. There's a cost, obviously, and you've got to always be mindful of that.
I was going to ask, it's covered under insurance, isn't it?
Yes, it is. And this is another reason why it is important to get somebody that's recognised, because insurance companies will cover behaviour, or most insurance companies will cover behaviour. However, they'll only cover certain group of behaviourists that belong to a recognised body. I've mentioned 3. There are some more, but sometimes it's useful to actually speak to the insurance company and say, "Oh, is it that you'll cover me for?" And that gives you an idea that whoever you're seeing is recognised.
It's regulated. Yeah. That's a really good point. And I know in years gone past there used to be like a limit, and it's still the case with hydrotherapy. It always does my head in, actually. 10 sessions of hydrotherapy.
Yes.
Like, well, that's just about 5 weeks worth. Thanks, great.
Yeah.
Is it the same?
There is a limit. I think it depends on each individual insurance company. They're the things that are really important to ask. I always say to people, you'll be covered, but there will be an excess. So it's important that people realise that. But I also mention to people that the examinations, that the veterinary examinations that are part of that behaviour, getting things checked out, should also be covered. So people don't realise that sometimes that the veterinary checks are actually covered under behaviour, because you check in for a problem potentially for behaviour. Then if they find something, then there's probably 2 different cases, and it's important that owners speak to insurance company and the vets. But yeah, you know, there's quite a lot. Certain medications will be covered that we use as part of a behaviour plan will be covered. So, you know, it's not just the consultation, it's the treatment that's part of that behaviour consultation as well that's covered.
Yeah, no, definitely. And I'm glad you touched on medication, because I think that was something that I had in my mind that I wanted to mention, because I was chatting to a client today, and today was probably the first day that you didn't hear her kind of like choke on her own words with the list of drugs that her dog's on. You know, it's taken months for her to not be in fear of polypharmacy.
Yeah.
And every time I'm trying to just calm her down, going, oh, it's absolutely fine, you know, 4 medications. We are doing very different things. We're using that to keep each one at the lowest possible dose. And we're affecting the pain pathway in different areas. And today was the first day that she didn't kind of go, and I was like, another one. Polypharmacy is potentially another obstacle that people need to become comfortable with in this realm. You know, so we've got a driver which is going to need some kind of approach, and that might be medication, interventions, there might be diagnostics to get there. And those interventions might be a couple of different medications. But then also there might be the scope that medications to allow the dog to learn might be
needed. Yeah. So this psychoactive medication that obviously is a veterinary, we can't prescribe those drugs. I don't even talk to clients. I mean, as a veterinary nurse, we've got to be really careful, because we can't diagnose, we shouldn't, and we can't necessarily always talk about drugs by name. But what I will always say is that there is some, you know, very, very useful drugs that will help have a window of opportunity for your dog to learn, because pain, because fear, anxiety affects learning. You know, you just don't think straight. The dog's not in the right spot to learn. They're above threshold, approaching that threshold where they're reactive. So sometimes it's really important to have that discussion with the client, and then I'll say, I'll speak to your vet about that, and then I can speak to the vet. Again, I'm lucky because I'm a veterinary nurse, and vets are very open to chatting with me about that. Some of my colleagues have said they found that can be a bit difficult.
It's really difficult. It's a terribly intimidating area for first opinion practitioners. And like referral vets, you know, behaviour medicine.
Yeah.
Okay, there's not many licensed
no, exactly.
Yeah. It's a field that makes you have sweaty palms.
Yeah.
And that's where actually approaching a vet that is a clinical behaviourist.
Yeah, and that's what I would always do. Yeah, so, if as a behaviourist, you know, if it's, I think getting a veterinary behaviourist on board, and that there, even if you've got the case, there are veterinary behaviourists that I will chat to, or that I'll say, right, I'm going to put you in the hands of this veterinary behaviourist, because that's something that they can give you really good advice. And often linking, particularly for behaviourists who might be listening, who don't maybe feel that comfortable having that conversation with the vet, they can actually say to the vet, I can put you in touch with the veterinary behaviourist. And if that client's insured, then that will be covered on that behaviour claim as well. So it's part, again, of that everybody working together and admitting there's nothing wrong ever with saying, I'm a bit out of my depth with this one. I know that there's going to be some medication, but I think in this case, I'd like to refer this to a veterinary behaviourist. There's nothing wrong with that. I think it shows strength in the vet, in the behaviourist, in the physio, everybody. I've always thought it's the mark of a good clinician if they know their limit and then will refer to somebody who knows more than them.
But I think what's quite exciting is that these mixed discipline in like centres. So let's use Sarah Heath, who is absolutely amazing. Yeah. I think we've interviewed her once or twice. So anybody listening, dig out on Cam YouTube, Sarah Heath. It's amazing.
Yeah. Used to sit in awe. I mean, when I was at Southampton, I just used to sit in awe of her, and yeah, she's just. It's just a kind of wave of knowledge.
we were at Irvat, weren't we, recently?
Yeah.
And we listened to Sarah Heath, followed straight by Claire Rusbridge, followed straight by Louise Clark. We were like,
Yeah, no,
incredible.
serious good stuff.
But then some of these people that are, offering clinical behavioural consults are now bringing in a physio that's on site, dog trainers that's on site. So you're beginning to get that multidisciplinary team in one place, which is really exciting as well. And it's so far removed from what I experienced 20 years ago.
Me too.
It's lovely, such good
It's
stuff.
lovely, it's great, isn't it? And it's so nice when you can feel, I think, being part of a team is lovely. It's because it's lonely being a behaviourist. I'd say that's the thing that a lot of behaviourists, we sort of share that feeling, that sense of can be quite lonely. It's a lonely old job sometimes. You're going out to see somebody you never know. That's the nice thing about the veterinary world. You're kind of part of this team. You've got the vets and nurses, and that's the thing that I do kind of miss, because you are a bit on your own. I mean, I've got some fantastic sort of network of other behaviourists, and we'll have chats on Zoom, and we'll meet up for a coffee now that we can, and local behaviourists, and that's lovely. It's really important. You're not an island. You can't be an island.
No, definitely. I'm going to let Evie kind of lead about Bonfire Night that's coming up for the last 10 minutes, but I really want to cover just a couple. This one I love. Well done, Ruth. You brought up a really, really good topic here.
Okay.
And I think it needs to be addressed. Do have caution. Do have concern in that means you're going to monitor. But what you can do in this situation is you do have to say to yourself, quality of life is important. We've made huge progression in what we can offer our pets now. When I look back to what we did for the pets 20 years ago, trying to balance behaviour with pain, with liver concerns, kidney concerns, all of this, it was like, I don't even know where to start. Whereas now we've actually got some really good understanding of how to best manage multiple conditions at once. But also go to bed easy, knowing that we monitor. So if you're in a situation where you're bringing in another medication, then just say to yourself, right, I'm going to monitor the liver. I'm going to do a liver blood sample on a quarterly basis. I'm going to do a bile acid stim. I'm going to keep an eye on their urine. I'm going to keep an eye on their appetite. So do not be in fear. Certainly use, objective monitoring, consideration, but don't be in fear. Okay. And by the way, my dog had surgery on her liver. She had to have 2/3 of her liver removed because of a tumour. And we scanned it about 4 months later, it grown back. The size of the liver. It was crazy.
That's incredible.
I know, really crazy. Thank you for letting me see that.
Yeah.
But, and there was another person that I just want to say thank you so much for saying what you said, because I want you to get in touch. This excites me. Currently working on a thesis on communication between vet and client regarding pain in OA dogs.
Absolutely.
Get in touch with us. We want to know about that. That is so cool. Right, I'm going to shut up. Over to you.
Your turn.
So Bonfire Night is a massive, and I think with behaviour, owners sometimes feel embarrassed to come into a vet's and say, look, my dog started biting me or started growling when I started it, because they don't know what we're going to say. And I think because it's so, like, a lot of cases like that have ended up with potentially put to sleep before, so they think that's the only option. I think Bonfire Night, is because it's on the TV, as soon as it comes up to Bonfire Night, it's like, oh, Bonfire Night's coming. Here's a calming medication, and your dog might be scared. I think behaviour as a whole needs to be made more approachable, and there are options, and it's not embarrassing to talk about it. My dog's got luxating patellas, and when her pain isn't managed, she growls at me. And I'm a vet nurse.
So you're saying because Bonfire Night and the stress with the noise that we might see a deterioration in behaviours?
yeah, but I'm just saying, like Bonfire Night, because it's so publicised, people think I think more people would come in and talk to us and say, I think my dog's going to have behavioural issues.
Yeah.
Or, so we help them. But we'll go over to you to why Bonfire Night is, and why, if your dog's in pain and got noise sensitivity, why it's so important to.
Yeah, I mean, there's been quite a few, well, humans can articulate this, but there's been some studies that sort of kind of show that pain does sort of enhance that noise sensitivity. So there's a link. And you said about migraine. Well, if you've got migraine or a pain like migraine, or even chronic pain that's been rumbling around, your musculoskeletal pain, then the noise can actually exacerbate the pain. There's a link between that. Some people say that noise can cause pains. Humans will articulate it. We can't ask our dogs, can we? Or any of our animals, unfortunately. But people will say noise can cause me to have some pain or can exacerbate my pain. So we know that that's a fact in humans. We're mammals. We share such a lot of similar sort of neurology. So it stands to reason that there's a strong possibility that's the same in animals. So there's that link. Also, when dogs are, you talk about kind of people being a bit embarrassed, and you allude into aggression, but I always say aggression is not a behaviour problem. It's a symptom of a behaviour problem. Aggression, again, I'll kind of use a bit of an analogy. Aggression is like diarrhea. Diarrhea isn't the cause. Diarrhea is the symptom of something else going on. So aggression is often a manifestation of something else, and in that sense, it's usually fear. If they've got an underlying pain, then every time they startle, that just sends that pain response, and then you've got the association of the noise with pain and the pain with that noise, and then it's just again that same squash onion that we talked about.
You like that, don't you?
I can't remember that one.
The mashy mix onion.
That mashed onion. So I mean, it is, but I do think you're right that people will see an advert and they'll think, oh well, I'm going to get that sort of that calming pheromone. Absolutely no reason not to have that as part of a multimodal plan, but it's on its own is unlikely to be the cure-all. It's part of a plan, and it's brilliant if people will go into the practice, because nurses, vets will be so happy, receptionists, but there's so many nurses mentioned right at the beginning are really interested in behaviour, and they love to talk about it. And now with clinics, I'll often say to nurses who are interested in behaviour, why don't you start out with a clinic, particularly at this time of year, Bonfire Night, giving advice about Bonfire Night, talking to people about how they can help the dog, what there is available, and thinking about that kind of whole plan that you can.
Wouldn't it be amazing if Vet Compass, which is the branch of the RVC that looks at what's being seen in practices, wouldn't it be amazing if we saw over the next few years that in the autumnal periods where Bonfire Night's looming, everybody starts being concerned about their dog's noise phobia. They do the noise phobia, possible systemic problem elsewhere. And instead of just assuming it's a noise phobia, go, what's driving this? And we see a sudden surge in diagnoses. There we go.
Study there. Yeah.
Correlation O'Neill on it. That'd be amazing.
Really interesting, wouldn't it? Yeah.
So that really comes to my heart though, because my dog had a noise phobia, and you've done the CAM Advocate course. I bleed a little bit emotionally at the beginning of this course. It's a 12 module course, but module 1 is going back through Holly's life and all of the intervention points where, now that I know what I know, I might have known sooner. And I think when she was around about 5 years old, she developed quite a significant noise phobia, and that actually is likely to tie in with her cervical disc disease and lumbar safety disease. But you only know what you know when you know it, don't you?
Exactly. You should never beat yourself up. I mean, I've made some right blunders, I say to people, I wasn't born with this this knowledge. I've learned it. I've experienced. Don't feel bad. Never, ever, ever feel bad. Don't, because it's just not worth beating yourself up.
So a definite take home is nurses like the lovely you would love people who know that looming period that now goes on for weeks with horrible bratty children buying rockets and setting them up on street corners.
And it's that, isn't it? Because it's like now and then we've got New Year, and there's probably Halloween where we might be letting a few off as well. I mean, it's sort of kind of grown, hasn't it, out of all proportion. And then after giving that sort of for want of a better word, firefighting advice, then after bonfire night, once that silly season's out of the way, talking to people about how they can help treat this desensitization, counter conditioning, all of that sort of thing. So it's a really lovely place for nurses to sort of cut the teeth on behaviour clinics and get because it's something that vet nurses know an awful lot about. They can give advice about, feeling confident about it. So then it's that sort of a whole
definitely vet nurses bring into the conversation, should we do a good clinical check over?
Yes.
And I look back, having been a vet for 21 years now, the amount of times I've got people through the fireworks season but never really thought to myself, well, this gives me a really big opportunity to really do a good health check. Why are they so reactive to this? So I take that.
Yeah. And that's a sort of message, I suppose, for everybody that's listening, that if your dog is really reactive at bonfire night, it is worth getting that checked out, that pain element checked out.
I love it. Good call. You've got a book coming out, haven't you?
I have, it's quite exciting, a bit scary. It's my first book. It's out on the 24th of October. It's called Fear and Anxiety in Dogs, Crowwood Press. So it's out on the 24th in a couple of weeks. So I've not even seen it. I've not held it yet. So I don't really believe it's there till I kind of look at it myself. So I've seen a PDF, but I've not seen it. So
and is it aimed at owners?
It's actually, the remit when I wrote it was for owners and anybody that's kind of coming into the profession. I've had quite a few. I've asked vet nurses to review it, and they think there's quite a lot of information in there for them. So it kind of covers, I would say, it's definitely one that accessible for owners, but there's enough about it, I think, for the veterinary profession nurses to get quite a lot out of it as well. I'm excited.
I love it. And I quite like buying books that are definitely aimed at owners, because I want to learn the language that is going to get me the best communication with owners. So, I could read the WSABA Global Guidelines on Pain Management. It drives you nuts.
So in and out of book as well. There's quite a lot of images, because I think that kind of conjures up 1,000 words when you can actually say, this is what fear and anxiety can look like, and little sort of boxes with case studies and just little, so you can dip in and out of it over a coffee break.
It's such an important thing. I know as a vet that I repeatedly have owners saying to me, I'll do anything, I just don't want him to be in pain. But I think you can easily translate to an owner saying, I'll do anything, I just don't want him to be in fear. And can you imagine living your life every day being scared of what's going to happen next? So I think it's something that we all need to really consider. We want our dogs to be happy. We want them to feel that they have an autonomous life. They independent in thought and behaviour. So we do not want our dogs to live in fear. So it's going to be a great. I like it. We need to say thank you to our sponsor, because I fluffed this at the beginning. Totally fluffed it. Here we go. Thank you, Bonfire. We're super, super proud to be associated with this brand. Really, really from the heart. I love it when you see a company that say, I've got to prove whether we work or not, and marketing and saying it's good for, big dogs who are suffering from orthopedic diseases. Well, they put the bed for a study at the University of Pennsylvania, and they spent a fortune on actually showing pilot study level that this did have an influence on pain, mobility, sleep quality, etc. So high five, Big Barker, for putting the money where the mouth is. It's good stuff. Thank you very much for looking after us this year. Till tomorrow, Evie's on her own tomorrow. So who are you interviewing tomorrow?
I am interviewing
Cecilia Villaverde.
Yeah, Villaverde.
Right.
So very exciting. We're discussing overweight preventions.
Yeah, and I'm just going to high five this lady massively. A lot of people don't realise she is double board certified. That means that she's gone as high as you can go, both here in the Europe and over in America. She's got a PhD in nutrition, and she's completely independent. So she runs her own advisory service for owners of companion animals, giving them independent nutritional advice. She's not attached to any food company.
Oh, it's good, yeah.
And this is big, and we are so lucky to have her on our board of advice.
I will be tuning in.
Oh my God, she is wonderful to talk to. So if anybody ever had a client that's got a dog with real nutritional needs, please do get in touch with Cecilia Villaverde. We'll put her details in tomorrow. But she's so approachable. She's super, super wonderful. Do check in tomorrow.
Great stuff.
Cool. Right. Let you say goodbye then. See you later, guys.
Bye.